we are opening some of the nerves, giving them some space, or ballooning them up and giving some space to the skin there. Hello, my name's Daniel Williams and I'm a D&M educator here in the UK. And in this video, I'm going to show you some treatment options using Dermo Neuro Modulation for lower back pain. Here we have the cutaneous nerves of the back, the superior clineal nerves here, and the dorsal rami here. There are a lot more in this area, so these are just a visual representation of but a few. What I'm going to show you is how to use Dermo Neuro Modulation, DNM, to efficiently calm down some of your client's back pain. So if we were to have back pain, say here, in this particular area, you could do several things. As you can see, as I'm moving the skin around here on the camera, we are opening some of the nerves, giving them some space, or ballooning them up and giving some space to the skin there. This sends a different sensation into the skin, which can make it feel safer, less protective, and allow descending modulations from the brain. Therefore, the pain goes away, ideally. So if we were to have pain here, I would move that across laterally, just the skin, and you can see that opening up there. I would always check back onto that area with palpation to see if the client or the patient there still experiences the pain. So just to recap, if we were to have pain here, I would have already palpated that area and the client would have told me that they've got pain there. I would check back, ask them whether there's still pain there as I'm checking and palpating it again, then move the skin in any direction. It doesn't really matter. The important thing is checking back and talking to the client and communicating with them. So if I laterally move the skin this way and press back on that area, I'll ask the client or the patient if the pain is still there or that feeling of threat is still there. If so, I move in a different direction, different vector, and open it up in a different way and check back to see if it is. You've got so many different ways you can move the skin. You could twist one way or the other, move the skin laterally, vertically, or even put it on and twist that way. And as you can see, with all of those things, these cutaneous nerves move in different ways, so you might be affecting this side by only moving this side. If you're experiencing SIJ pain and anywhere atop of the glute, you can actually target these superior clineal nerves to help with that. So if we have pain here anywhere around the SIJ, just by moving that skin towards the glute laterally and down, that will open this area up. Now, if you need to, you can open that way as well, and that will lift the skin around that area, much like what we think rock tape does, but it moves it over as well in that direction. Gives these clineal nerves some space. And as you can see here, that is where the perforations come through those layers into the skin from that area. So if we were to do that from that side, you could also move laterally here and move across that way to elicit the same response. So you don't have to be on those nerves to affect those nerves. Hold for 3 minutes when you get to that point of positional relief, and then check back with the patient and see if it's helped. Just to recap, find the point of pain, move the skin in any direction that provides positional relief when palpating back for that client, hold for 3 minutes, and then gradually go back to normal, take it off, and then retest with your client into the movement or palpatory pain. Here's a skin stretch technique that I use pretty much every week in clinic. So people will present with Piriformis syndrome pain somewhere around here. So if we were to put a star where that pain is, and what I would do is, as I've checked back there and palpated it, and it hurts on palpation, I would then proceed to move the skin in all different positions, but also checking back to make sure that the client gets the relief from it. So for instance, if I were to bring it this way, you can see that star actually stretch as well. So the skin is moving underneath, the nerves underneath that are moving. I can check back and press on that same spot again, and the patient will tell you if it hurts or not. If it doesn't, stay there, hold it for 3 minutes. If it still hurts, try a different position. It really is individual to the patient in front of you. So if you need to, you could move this way. No change, yeah? How about if I do down and round here? Does that feel softer to you? Does it feel less painful? Good, let's hold that there for 3 minutes. Okay, and I'd hold that for 3 minutes, check back afterwards, very slowly bring it back, and then relax. Check back, see how it feels, and then get them to move and retest as necessary. Thank you for watching, and if you'd like to learn more about Dermo Neuro Modulation, you can get in contact with me with my details that are in the description below.